Good afternoon. My name is Alyssa Jade Wilson, and today for my oral presentation, I want to discuss the need and importance for more women-centered substance abuse treatment programs in local communities and how these women-centered substance abuse treatment programs can lead to an increase in recovery rates and overall compliance and care. With the common integrative approaches used in substance abuse treatment programs today, you may be wondering, why simply is there a need for women-focused treatment programs? Well, here's simple, and I'm going to tell you. Oftentimes, when seeking treatment, women are often faced with unfair treatment such as discrimination, biases, and social stigmas based on their gender, race, ethnicity, social class, sexual orientation that makes it 2 to 3 times harder to fully stay compliant with care, especially in these programs that use integrative approaches. Women need a safe, empowering, and comfortable environment to be able to fully be comfortable to express their needs and express their concerns. If they don't feel comfortable addressing the root cause and the root problem of their substance abuse treatment, then recovery rates are going to stay the same. They're not going to be compliant with care. I'd like to point out that multiple research studies have been conducted and have shown that using gender-specific approaches in substance abuse treatment programs lead to increased recovery rates, increased compliance, and a decrease in the use of illegal substances. Women need to have the opportunity to feel comfortable and be around other women that can understand their struggles, such as domestic violence, parenthood, social stigmas, and oftentimes women are not going to feel comfortable opening up to other men. So who better to understand women than women themselves? I'd like to point out the current statistics. Worldwide, 43.3 million women have a substance use disorder. And within these 43.3 million women, 27.2 use illegal substances, 7.1 use illegal substances and alcohol, and 8.2 have both a substance use and mental health co-occurring disorder. Now, with integrative approaches, you're going to often find that the rates are going to stay the same and substance use is going to continue to skyrocket. So, in order to prevent these rates from skyrocketing and increasing on the daily, we need to be utilizing gender-specific approaches. I want to point out today the gap in numbers in Georgia. So, just in Georgia alone, there are 410 substance abuse treatment programs that men and women can go seek for proper treatment and help. Now, out of those 410 substance abuse programs, only 100 are women focused. So that means that out of the 410, women only have 100 options to choose from to get proper women-centered care. This huge gap in numbers should place a spotlight and an emphasis on the need for establishing more women-centered substance abuse treatment programs in local communities. I've also included current research studies. Specifically this one. This research study was conducted in 2020 to 2021 in the University of Santiago by college students. These college students interviewed healthcare team members and professionals in the 3 regions with the highest substance abuse rates. These 3 regions being Metropolitan with 47.5%, Valparaiso with 8.2%, and Baya with 6.5%. And after this data was analyzed and the research study was concluded, researchers found that when implementing gender-specific approaches to substance abuse treatment programs lead to better benefits, leads to more recovery rates, and decreased substance abuse treatment, or substance use altogether. Another research study I have included comes from the peer-reviewed American Journal of Drug and Alcohol Abuse. This research study used a comparative approach comparing integrative methods versus gender-specific methods and to see which one has better results. The total participation of this research study was over 3,000 total women divided up into 19 controlled trials. After the research study was concluded and the data was analyzed, researchers found that 15 out of the 19 total controlled trials that used integrative approaches led to no better recovery rates, led to no benefits, no better outcomes, and it did not lead to decreased substance abuse or substance use altogether. With that being said, since there is such a high 15 out of the 19 that had no effect, this goes to show that when utilizing gender-focused interventions, this will lead to better outcomes versus integrative approaches. Another big question you may be asking yourself is, well, simply how do we establish these women-centered substance abuse treatment programs in local communities? Here's my 2 recommendations. I say we increase the funding from local, state, and federal government officials to take these funds, more funds, to create more opportunities for women in local communities. More specifically, the funds that we receive from the Georgia Crisis Abatement Trust, which this trust is every year there's a certain amount of funds that gets released and divided up into specific programs that are used to help women and men with substance abuse, active abuse, mental health, treatment disorders. I'd like to point out that with this trust, there is a huge gap and a huge unequal and unfair financial treatment based from men versus women. For example, only $85,500 was given to the Homestead Women's Recovery Center versus $230,060.52 to Divergent Recovery Care Center for Men. This goes to show that more funds are getting poured into the men-focused substance abuse treatment programs and less funds are getting poured in to the women's focused substance abuse treatment programs. Not only that, I also pose for increased Medicaid expansion to pay for more than 28-day stay for women. Substance abuse recovery is not a one-size-fits-all approach. Some women fully recover in 28 days or less, where some women take multiple months to years to fully recover, with an average rehab anywhere between 3 months to a year. So after that 29th day, women are expected to pay for these such outrageous costs out of pocket. And since they have to pay out of pocket, this leads to relapsing and decreased compliance because they're having to leave the program earlier than they would like. In conclusion, her recovery matters. Our recovery matters. It is difficult for women to adhere and stay in substance abuse treatment programs utilizing integrative approaches because these integrative approaches do not take into the specific account what women go through, the stigmas, the biases, the oppression, the unfair treatment. I'd like to also reiterate that when using women-centered approaches, this will lead to decreased substance use and increased recovery rates. We need an environment free of discrimination, free of unfair treatment. Women will open up to other women before they open up to men in an integrative setting. And I'd also like to say again, who better to understand women than women themselves? Thank you so much. This concludes my presentation.